Does Labor have an alternative plan about how we can live with this virus?
Well, I think the experience we've seen all around the world is the first thing you have to do is vaccinate the population, and you have to do it in good order. Make sure particularly that the most vulnerable members of the community and those who are caring for them are vaccinated first of all. And this is really where we're running so far behind the rest of the world. I think you said in your intro, Laura, that we're dead last in the OECD with only 4% of the population fully vaccinated after more than 4 months of the vaccine rollout. So there is no substitute. There is no alternative pathway out of this pandemic other than vaccination. And we've performed appallingly badly on that because Scott Morrison, frankly, didn't attach enough urgency to it. He said it's not a race. And his very slow attitude to this has left us in a very, very difficult position as we deal with these very infectious variants.
How concerned are you that even when we do reach herd immunity, whether that be earlier next year or even a little later, and you're right to point out the slowness of the vaccine rollout, but what happens then, in your view, Mark Butler? Do you end the cycle of lockdowns when we reach that herd immunity rate?
Well, I mean, that's where we have to get to. That's where the world needs to get to as well. I mean, we can't have one nation vaccinated without being vulnerable to the rest of the world. That's why it's so important as well that we continue to support efforts to vaccinate poorer countries who aren't having the same level of access that richer countries are having to vaccines, because as the virus continues to spread around the world, it will continue to mutate. We'll see these more infectious variants that potentially are resistant to some of the vaccines. So we will also have to probably consider booster shots in the near future, probably towards the beginning of next year. But we're so far behind the rest of the world in getting the original generation of vaccines into the Australian population that even that is going to be delayed as well. The UK, for example, is considering booster shots as early as September, October this year. At that point, we'll be nowhere near fully vaccinated in order to be able to consider booster shots to deal with these very infectious variants.
Example, because this is a really interesting one, and one the Prime Minister referenced in his media conference last night. The UK at the moment, with the Delta variant, has around 18,000 new cases a day, which is very high, the highest it's been in months, but it has less than 20 deaths a day and hospitalisation rates are coming down. The vaccine is working. Do you agree?
Absolutely, absolutely. Now, I think the experts agree that we'll probably need booster shots to deal with these variants. I mean, the vaccines aren't quite as effective against the Delta variant as they are against the original strains of the virus, but they are still highly effective at stopping hospitalisation, highly effective at stopping particularly severe disease and death. But, you know, the plan has to be to get the original generation of vaccines into the Australian people as quickly as possible. So we are ready as well to deal with the booster shots that will be needed to add that level of resistance to the variants. Now, we've only seen I think the New South Wales Health Minister, Brad Hazzard, pointed this out a day or two ago, that the party in West Hoxton of 30-odd people that's seen 24 people infected so far, all of those 24 were unvaccinated, whereas the 6 or 7 people who have not been infected by COVID were all vaccinated. We've got our own little case studies here in Australia that illustrate the importance of getting vaccinated. The problem for the Australian population, though, is that their Prime Minister didn't do enough deals early enough to ensure that we have the supply that we need.
Okay, that's a great example as well. The vaccine is working. So what would Labor do once we are all vaccinated? And I appreciate that is at least until the end of the year or maybe even early into next year. Would Labor continue to pursue this elimination strategy that we've got at the moment, or would it be a suppression strategy where you accept that there is going to be infection and hospitalisation and maybe even some deaths, but minimal?
Well, I think, Laura, that really is a conversation for further down the track. I mean, I don't think the Australian people, when only 4% of us are fully vaccinated, are in a position yet to have that conversation. We are so far from getting to that level of herd immunity. We don't know what the variants are going to be. We don't know what booster shots we'll need to add to the Australian people's resistance at that stage. This is a conversation, obviously, every country, including Australia, will have to have at some point. But I heard the New South Wales Premier, the New South Wales Chief Health Officer say only yesterday, we can't start that conversation while only 4% of the population is vaccinated. And I think part of the challenge with Scott Morrison's approach to this is he keeps trying to take us off into these alternative cul-de-sacs instead of focusing on the basic job he has, and that is get people vaccinated and put a proper quarantine system in place to protect us in the meantime. And he's failing on both of those jobs. Until they're both done properly, we will not be in a position to have that conversation in a meaningful way.
Well, I guess there's thousands, if not millions of people around Australia at the moment looking for an alternative plan. Is Labor willing to offer that in the lead up to the election? Do you accept that this will be endemic and we are going to have to accept a level infection and deaths?
Well, the health experts all say that this virus is likely to be endemic for some years. We know, for example, that the Spanish flu in one form or another, the flu that gave rise to the pandemic in 1918, 1919, was with the world for decades after that. We had to learn to live with it, particularly through vaccines. So this is not going away next year. Every health expert says this is likely to be with us for some years. But the first job is to break the back of it with this extraordinary generation of vaccines that researchers and pharmaceutical companies around the world have been able to present us with. Get as many of them into Australia as possible, and then get as many of those vaccines into people's arms. But that really is the challenge that we have now. Once we do that, I think the Australian population will be keen to have a discussion about what's next. And this is really a series of stages. In the first stage of the pandemic, Australians locked down. They engaged in social distancing and all the other restrictions to prevent community transmission, and we performed as well as any country in the world. The second stage, though, vaccinating and having a good quarantine system in place in the meantime, relied upon strong efforts from the federal government, and they just haven't been up to scratch. They haven't done their job properly. If we can get that back on track, then I think we're in a position to have a discussion about the third stage, which is, as a vaccinated population, how do we then start to live with the virus that is likely to be in some form or another still endemic around the world?
Do you accept that there's been a lot lacking in political leadership right around the country from the premiers and the Prime Minister? People are scared, and it's because of the way we report, the way we lock down, impose restrictions with just a handful of cases. I look at your state at the moment, Mark Butler. There are 0 cases, the borders are closed, and restrictions have been reimposed on businesses in South Australia.
And I'm in quarantine for having been in Canberra. I think the thing that I think has served the country well is that we've not sought to substitute political views for strong public health advice. And we've seen in countries over the last 12 to 15 months where that has happened, it has usually resulted in tragic outcomes. And I think what we've done here at state level and federal level, Labor and Liberal alike, is to follow the health advice. Now, that has been quite strict in this country, which is why we've avoided the huge numbers of deaths that we've seen overseas. So I'm not going to quarrel with the decisions that premiers are taking based on their public health advice. They do that, and I think they're answerable to their people. And I think what we've seen is that the people generally have supported those decisions by and large, in spite of the fact that they have huge economic implications for people. People do want to prevent this virus running through the community. I think what's been lacking is the federal government backing up those state decisions with a quick, effective rollout of the vaccine so that we can get to that third stage I talked about having a discussion about how to live with the virus. And because that's taking so long, we're stuck in this sort of nether region, really, of having effectively largely suppressed the virus last year, now living in this sort of nether region where only a very, very small minority of people are protected from the virus through vaccination, and we're having to live through again these lockdowns.